Next, Rachel Kurtz, Don Pierce, and Sheriff John Stanza. Rachel, why don't you just go ahead and begin?
Thank you, Mr. Chair and members of the committee. My name is Rachel Kurtz. I'm Executive Director of the Cannabis Defense Coalition. I'd like to thank Senator Cole Wells for her tireless efforts on this really difficult issue. With that, the Cannabis Defense Coalition respectfully opposes this bill, and mainly it's for the registry. We understand this is a voluntary registry, but it only provides, this bill only provides arrest protection for people on the registry. Therefore, patients will feel forced to join this registry that they may not want to be on, or they'll be forced to face hostile law enforcement. While currently there is no arrest protection for anybody, law enforcement uses their discretion when encountering a patient with their authorization. If a registry was created, we're afraid law enforcement wouldn't use their discretion, but merely arrest anyone not on the registry. Therefore, we fear more arrests by people who choose to rely on their authorizations only as proof of their status as a patient. The CDC believes that authorizations should be the only proof needed to prevent their arrest, unless there is proof of an actual crime being committed. Being a medical cannabis patient is not a crime. Thank you.
Thank you. Next.
Mr. Chairman, members of the committee, for the record, Don Pierce with the Washington Association of Sheriffs and Police Chiefs. We're here today in opposition to Senate Bill 5955, due in part or in large part because of the creation of dispensaries. We have opposed dispensaries since the beginning of the discussions about this legislation. We prefer a pharmaceutical or a medical model, and we believe that we should begin immediately to have medical cannabis rescheduled as a Schedule II drug. Therefore, it could be distributed through pharmacies. We think that's the appropriate method. In the meantime, until that has occurred, we've had three objectives in the legislation, and we appreciate working with Senator Cole Wells. She's been very open with us about the legislation. We support arrest protection. We believe that you should clarify that the current dispensaries are illegal, and that we believe there should be improved access to medical cannabis for qualifying patients. We believe that the current bill, as signed into law, accomplishes two of those three. It does clarify that current dispensaries are illegal, and there is some improved access because of the community gardens. It's not a panacea, but we do believe that it does improve the situation. With regard to arrest protection, because of the entanglements with the rest of the bill, that portion was vetoed from 5073. So we do support a registry, a voluntary registry that would lead to arrest protection. Thank you.
Thank you. Next.
Thank you, Mr. Chair, committee members. I'm John Snaza, Thurston County Sheriff. First off, I'd like to apologize to Senator Cole Wells for being rushed into this legislation and this bill. I really believe that if we're going to legalize medical marijuana, let's make it a scheduled drug, a Schedule II or a Schedule III. Let's get the medical people involved in this, the pharmacists, Department of Health, doctors, so that it can be prescribed and that we can deal with it appropriately. Asking for local law enforcement to be involved in the registry, first off, and to regulate, there is no funding. We all know that there's no budgets for this. Although the bill establishes a registry, there is no mechanism for or law enforcement capability to ensure that the mandatory reporting required for collective gardens and nonprofit patient cooperatives is actually occurring. I believe that this bill is going to make it even tougher on not only the sheriff, myself, but also local entities like the police agencies for trying to regulate this without making it a scheduled drug. So thank you for your time. Good luck.
Thank you. There was a question, Senator Flug.
Oh, thank you. My concern is, and maybe the pharmacist behind me can add, but I'm not aware that the state of Washington has the power, particularly that would survive in court, to reschedule the FDA's decision. So given that that's the case, if we don't have dispensaries, where would these authorized patients get, how could they legally get their medication?
We went on for about 8 years after the legislation, or after the initiative was passed, without dispensaries in large number in the state. The dispensaries, as we see them today, have really cropped up within the last couple of years. We believe that access for patients is difficult, and that's why we supported the community gardens, where you could join with someone else who had the expertise to grow the medical cannabis. We don't believe that that is a total solution. We believe the solution is for the state to reclassify or reschedule and to petition the federal government to recognize that rescheduling, and that's the only ultimate solution. We don't believe that the dispensaries, in whatever form they're called out, will survive the muster, will survive the test of the federal law enforcement agencies, and we don't believe we should put anybody in that position.
Senator Parlett.
Thank you, Don. Well, as you know, as a registered pharmacist, number one, we can only dispense legal drugs in pharmacies. We all know that. And it does require a change at the federal level. So I don't know if this is happening all across the country or whatever, but obviously, if marijuana is going to be rescheduled, it has to be done at the federal level. And I think we all have to recognize that in Washington State.
Senator Conway.
This question for staff. Has any state reclassified the drug? Are you aware?
I believe Oregon has, and I think there's some talk that maybe Iowa is considering it.
So some states have already started the process.
Correct.
Thank you.
Senator Kaiser.
Thank you, Mr. Chair. You might check the intro sheet today. Senate Bill 5957. It would change the schedule. Thank you.
Okay, thank you all very much. That completes the hearing on 5955. My apology to those